Hi dear friends, I am Dr. Diwagar, B.P.T, physiotherapist. Today let us discuss about without CT MRI, how can we differentiate the stroke patient. First of all, what is stroke? Stroke means nothing. Stroke definition is stroke, it is a non-progressive focal disorder at least more than 24 hours. It's a stroke. Simply I said it's a paralytic attack. Okay, without CT MRI, how can we differentiate? Actually, the upper limb is mostly affected than lower limb. Then the speech impairment. If we are noticed the symptom in any stroke patient, that is that is called as middle cerebral artery lesion patient, MCA lesion patient. Again I said upper limb is affected than lower limb. Then patients are having speech impairments. Okay, speech impairments. Then they are having some problem. Okay, that patients called as middle cerebral artery lesion patient. Then the lower limb is mostly affected than upper limb with bladder and bowel problem, bowel involvement. That means the continuous urination or the loss of the urinary bladder, the loss of the maturation reflex. So urinary bladder involvement with lower limb is mostly affected than upper limb. Now that patient having that patients are having ACA, anterior cerebral artery lesion patient. Okay, then patients are having visual symptoms. They are having visual symptoms now. That patients are having PCA, posterior cerebral artery lesion. In specifically the middle cerebral artery lesion, upper limb is mostly affected than lower limb. Upper limb is mostly upper limb is mostly affected than lower limb, then the speech impairment, then the cognitive problem also having the middle cerebral artery lesions. So without the CT MRI in the neurology and neurosurgery ward, the clinicians they are find out easily they are find out which one is having anterior cerebral artery lesion or middle cerebral artery lesion or anterior cerebral artery lesion. Actually, I hope it is very useful for B.P.T physiotherapy students, MBBS students, and other medical professionals. I hope all are understood about these without CT MRI. How can we differentiate the anterior cerebral artery lesion or posterior cerebral artery lesion or middle cerebral artery lesion? Actually, whenever actually I want to say and I want to give some alert to whenever the patients are having mouth deviation and and the patient cannot raise the arms and slurring of speech and severe headache. If you are finding now, immediately go and take CT MRI. Then okay, well, then only we are knowing the patients are having infarctive stroke or hemorrhagic stroke or anything. Because in the neurology and neurosurgery, in the neurology, if brain cells are degenerated, regeneration is not possible. Spinal cord have spinal cell had a capacity and power of the regenerative cells, but the brain in the naturally the brain does not have regeneration power. Once degenerated, it's a pure degeneration. Regeneration is not possible. So immediately take the physiotherapy treatment. Physiotherapy treatment only, it will save and it will protect your movement. It will save your movements. It will save your kinesthetic sensation. Kinesthetic sensation means the joint position sense. So each and everyone, general public, you should create awareness about physiotherapy. After stroke, the physiotherapy is the only and must treatment. There is no treatment for stroke recovery. The neurologists they are given medicine for the clot. They are given clot or hemorrhage, anything. They are given only medicine for clot. After that, the kinesthetic sensation, that means the joint position sense and the patient recovery, everything based upon the physiotherapy treatment. So the treatment is neurological treatment, neurodevelopmental techniques. So each and everyone go and consult with physiotherapist and take physiotherapy treatment. Thank you so much. Bye bye.